Hi everyone, welcome to another episode of Ask Dr. Chi. My name is Dr. Chinoye Otuka AC, your #1 fertility blog. Today we'll be continuing on our series of lifestyle factors that impact or helps us optimize our chances of getting pregnant. So with the last episode, we did talk on the role of prenatal vitamins, the role of supplements, and the role of fertility diet. Today we'll be elaborating on the importance of timing as a factor, the importance of positioning as a factor, and lastly, the effect of stress as a factor that can either improve our chances of conception or reduces our chances of conception. Let's dive right into the video. Timing. Now I get this a lot. Doctor, what is the best time to have sex? Now, for timing to be effective, you must have a regular cycle. Now, for your cycle to be regular, you must have an average of a 28-day cycle, or your cycle must range between 21 to 35 days. This is the normal range of a menstrual cycle. So between 21 to 35 days or an average of 21 days. Now, if your cycle is regular, the next thing you should do to get the timing right is you should know how to track your ovulation. That means you should know when you ovulate. Now, if you know when you ovulate, you can know the right time to have intercourse to have a higher chance of conceiving. I'm trying to say that wrong timing equals no pregnancy. Right timing equals increased chances of conception. For the timing to be effective, I said first you should have a regular period. That means an average of 28 or between 21 to 35 days cycle. That means it shows your period is regular. Now, if your period is regular, the next thing you should do is to track your ovulation. That means you should know when you ovulate. Now, there are several methods in which we track our ovulation, which we'll elaborate in upcoming videos. Now, the first method to track your ovulation, you use an ovulation app, which tells you the time which you should ovulate. You can use the ovulation predictor kits, OPKs, in which you use a strip, put it in your urine to check if you've ovulated. You can use basal body temperature, and you can use cervical mucus monitoring. So these are ways in which you know when you ovulate. The app and the kits are more predictive. Basal body temperature is more of a confirmatory method, because your body temperature rises when corpus luteum is already formed and when progesterone is already formed, and that is usually after ovulation. So it tells you that you've in fact ovulated. So it's more confirmatory than predictive. So I prefer the app, the kit, and cervical mucous membrane. Positive cervical mucous membrane equals to have sex at that day. That means you should start it some days before to be able to know that this test is positive. You put 2 fingers into your vagina, you bring it up, you see a egg white sticky stuff. It's called a type 4. It shows that you've ovulated. So you have to start a few days before to be able to know the right time you ovulated. So I said your period must be regular. You must track your period for timing as a factor to be effective. And lastly, you must know your fertile window. Now, if you track well, you know the days in which you're fertile. Now, what is your fertile window? Your fertile window is the day of ovulation and 5 days preceding that. That means a 6-day interval ending on the day of your ovulation. So when you know when you've tracked and know exactly when you're ovulating, then you can now start using any of the tracking method to know the actual day you ovulated. So I tell people, if knowing the exact time is cumbersome, so you take advantage of your fertile window. So you start having sex 5 days before the day you think you ovulate. So you can be having sex daily or every alternate days. If you cannot, you're not a daily person, you do every alternate days until the day you ovulate. Or if you want to be exact, you can have sex a day before you ovulate, the day of ovulation, or the day after ovulation. So any of these can help you optimize timing as a factor to optimize your chances of conceiving. Now the next one we're going to talk about is positioning. This is the fourth, positioning. I get it a lot. Doctor, please, what position is best? Should I raise my leg after? Should I not urinate? Should I do this? Should I not do this? Now, research shows that there is no effect on positioning as a factor to improve your chances of conception. So any position that you love, that makes you feel okay during intercourse, enjoy yourself. So there is no need to lift up your leg. As far as your partner ejaculates, that means there's a release of sperm, you're fine. So there's no need to raise your leg up 10 minutes after. There's no need to hold the urine until 20 minutes after before you go to urinate. Because the reason is that sperm is motile. So after ejaculation, the sperm begins to move. So whether you urinate or not, it doesn't impact on your chances of conception. So positioning does not matter. So don't keep engaging in position of sex that you don't enjoy. So any position is fine. So position is not a factor that improves your chances of conception. The last but not the least is stress. Does stress affect my chances of conception? I get that question a lot. Yes, it does. Now the question is how, and the question is why. Now, how does stress impact? Now, it increases a hormone called cortisol. Now, before I continue, we are going to do a video on stress and fertility. It's a very broad topic. There I'm going to break down the different pathways and how they relate and how they affect conception. But in this video, I'm going to give a summary of the impact of stress, what hormone comes when you stress, and how it affects your chances. I know that stress, to a large extent, we can't control stress. But there are some stressors in which we can control. There are some stressors in which we cannot control. Now, the ones we cannot control, we have a way to navigate or mitigate the effect of those stressors on our health. You understand? So there's a way to mitigate. The ones you cannot control, there's a way to go around it so it will not impact. Because research shows that there's a study carried out when they fluid from several women undergoing IVF. A fluid was taken from follicle, and they found out that those women who have been exposed to the hormone, the stress hormone, they found out that they had a decreased chances of fertilization. They found out that the air quality was low, and thus their chances of fertilization was low. They also found out in those women that there was a decrease in the uterine lining. That means that covering where the baby stays, that covering did not grow well. So there was a decrease in the uterine lining and a decrease in the endometrial thickness. And also in the same study, they showed there was a decrease in what we call the VEGF. This is the vascular endothelium growth factor. Now, this factor is very important in implantation. That means when the baby will implant. So that factor is low, and thus the implantation rate for those women that are undergoing IVF was low. Another study was carried out where this was people who were undergoing natural fertility. That means you're not doing IVF, just natural. A group of women were collected, and they took the saliva to check for this stress hormone. And they found out that those women who has an increase in that stress hormone in their saliva had a decrease in their fertility 2 times. There's a twice reduction in the fertility rate in those women. That means those women had 2 times the inability to conceive. So you see, stress is a factor that sometimes we trivialize. We say, doctor, I beg, anybody with stress. Yes, I know anybody with stress because of, the long time looking for a child. I understand that. But you should also know that this factor has a negative effect in your chances of conception. The issue of stress cannot be overemphasized. Now, the issue of stress has an impact in our reproductive life, from reducing the egg quality to reducing fertilization rate, to reduce implantation rate, and also it has impact on reproductive outcome itself. In that women who are exposed to stress have children with birth defect, children with low birth rate, and children with growth retardation. So it's not only affecting you trying to conceive, it also affects your result of an ongoing, or the outcome of an ongoing pregnancy. So what can be done? Now we know that there are some stressors that are inevitable. For example, the loss of a child, a woman who is grieving from the loss of a child, loss of a partner, a doctor who is doing their residency. There's some stress that you can't control, but there's a way around it. You can mitigate, there's something you can do to control it. Now, and there are some factors that you can't control actually. So those ones you can control, please control. What are the things you can do to reduce your stress level? Sleep. For me, if I want to sleep, I'm so tired, I'll begin to watch a movie. And the movie will be watching me, and I sleep. Some people, they listen to music and they sleep. Some people, they eat, when they eat a lot, they just sleep at that point when they are eating. So whatever works for you, sleep. Lack of sleep is like pouring fuel into fire. So it worsens the stressors. It worsens it a lot more. So sleep is one factor that you can use to mitigate. Sleep, 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 sleep. As much as you can, sleep. 2, say no. Now, I'm saying this to say, if you know that there are certain environments that are triggers. So if you know going to child dedication, instead of it to make you happy, it makes you sad. You say no, you don't go. It's not that you're not wishing them well. You're protecting yourself. If going to those gatherings will make you happy, by all means do. There are some places you have to go to work. Even if there's a trigger at work, there's something you do, you have to block your mind to any environment at your place of work that will affect you or to trigger that stressor. You understand me? So if it means avoiding certain colleagues, do that. If it means standing there and pretending as if you're listening when you're not listening, do it. It's very important because, as I've explained, it has a tremendous impact on your fertility and reproductive outcome. 3, set boundaries. It's not everywhere you should go to. It's not every invitation you should honor. You understand? Engage in one activity that you love. If you love going out, go out. If it means taking a vacation, take a vacation. If it means joining the choir, do that. Singing, dancing, exercise for me does a whole lot. You exercise. If you want to do yoga, you do. Meditation, whatever works for you, whatever will increase that happy hormone in you, do it. Have compassion on yourself. Choose yourself first, because stress is a factor that needs to be controlled, that it must be controlled. Stress is a factor that must be controlled. Let me break down the factors from first to. I talked on prenatal vitamins, I've spoken on supplements, I've spoken on diet, timing as a factor, positioning, and stress. If you love this video, subscribe, like, follow. If you want to know more about our upcoming videos or our upcoming uploads, please press the notification button to know whenever I upload. If you have any questions or you want a one-on-one consultation with me, you can send me an email at askdrchi@gmail.com. I will respond to you. Thanks for listening and watching, and God bless you.